Morning always begins the same way, with a quiet moment where the body is still somewhere between rest and movement. Your circulation is slow, your breath is shallow, your muscles haven't fully awakened, and every internal system is trying to find its rhythm again after hours of low activity. It's a fragile moment, one you don't usually think about, yet it shapes how your entire day will unfold. And it's in this exact moment that a habit many people repeat without hesitation places an enormous amount of pressure on the veins deep inside the pelvis. A habit that feels harmless, automatic even, but that increases vein pressure dramatically and sets the stage for pain, swelling, and irritation during your first bowel movement of the day. Most people don't realize how vulnerable the lower veins are when they first wake up. During the night, blood flow slows down, the pelvic veins remain fuller than usual, and the digestive system moves almost in slow motion. When you open your eyes and step out of bed, your abdomen tightens slightly, your diaphragm shifts downward, and your body tries to restart all at once. In these first minutes, the veins around the rectum and lower pelvis are not ready to handle sudden pressure, and any extra force can overwhelm a system that's still half asleep. What begins as a small, barely noticeable discomfort in the morning often grows into the burning, heaviness, or pain people feel later in the day, symptoms that seem random but follow a clear physiological pattern. And just before we go deeper, take a moment to subscribe to Relief Health. This is where you learn what truly happens inside your body in a clear, grounded, and simple way that finally makes sense. Because now that you understand how fragile your body is during those early moments of the morning, it's time to look at what exactly happens inside you during that first hour of the day, and why this is the precise moment in which one common habit becomes the trigger for increased vein pressure and pain. When you wake up, your body is not instantly ready for effort, pressure, or strain. Even though your eyes are open and your mind begins shifting into daytime mode, your internal systems are still catching up. Your blood vessels haven't fully expanded yet, your breathing remains shallow, and your circulation is slowly redistributing itself after hours of lying down. During the night, gravity works differently. Blood pools more easily in the lower pelvis, and the veins around the rectum become slightly fuller. They are not damaged, just more sensitive, more stretched, and more reactive than they will be later in the day. Your abdominal muscles also wake up tight. The core muscles that support your organs and stabilize your spine emerge from sleep with stiffness, not flexibility. The pelvic floor, which should relax during bowel movements, awakens in a state closer to tension than ease. And the digestive system? It is nowhere near ready. Intestinal motility is slow, almost hesitant. The nervous system that coordinates the contraction and relaxation inside the gut is still transitioning from its nighttime pattern, when everything moves at a minimal pace. As you sit up in bed or stand, your diaphragm shifts downward and increases pressure inside your abdomen. It's a natural adjustment, but it adds weight onto the pelvic veins that were already somewhat filled from the night. At the same time, the colon begins to reposition its contents simply through gravity. Gas and stool that rested quietly during sleep start moving downward, creating a subtle sensation of fullness that many people misinterpret as an urgent need to use the bathroom, even though the intestines are not actually prepared for evacuation. This moment of transition is delicate. Your veins are not yet supported by fully active muscles. Your pelvic floor is not coordinating properly. Your gut is not awake enough to produce a smooth, natural bowel movement. And because everything is still stiff, slow, or congested, any extra force or pressure, especially pressure directed downward, magnifies instantly, much more than it would at any other hour of the day. This is why the morning is the exact moment when a single habit can damage the veins, trigger inflammation, and create the pain that follows you for the rest of the day. Not because the habit is extraordinary, but because your body simply hasn't switched on yet. And the more often this pressure is applied, the more sensitive and reactive those veins become over time. Now that you understand this morning vulnerability, it's time to reveal the habit itself, the one action that so many people do automatically, without realizing that it forces the pelvic veins to handle a level of pressure they cannot tolerate at this hour. The habit that increases vein pressure in the morning is so common, so automatic, and so deeply built into people's routines that most never question it. It's the act of going straight to the toilet as soon as you wake up and trying to force a bowel movement before your body is ready. For many, it feels natural. Wake up, walk to the bathroom, sit down, lean forward, hold the breath for a moment, and push. But pushing in those first minutes of the day places enormous strain on the pelvic veins, at a time when they are least able to handle it. The digestive system does not generate a natural urge to evacuate immediately after waking. What people interpret as morning urgency is often nothing more than downward pressure caused by gravity shifting stool and gas into the lower colon. The gut has not started its rhythmic contractions yet. The nervous system that coordinates relaxation of the pelvic floor is still quiet, and the diaphragm, which plays a central role in relieving abdominal pressure, is not working in full amplitude. Everything is slow, tight, and unprepared. When you sit on the toilet in this state, the body instinctively tries to help. The abdomen tightens, the pelvic floor reflexively contracts. The diaphragm moves downward without coordination. This combination sends a heavy surge of pressure straight into the veins surrounding the rectum. These veins, already fuller from the night, begin to swell even more, and when you force, even gently, even briefly, you add sudden internal pressure that pushes against the walls of these veins with far more strength than you realize. Many people feel a slight heaviness, a faint burning sensation, or a sense of pressure when they sit down on the toilet in the morning. Those sensations are warnings. They are the body saying, "Not yet," long before real pain appears. But because this routine feels normal, people ignore those warnings and keep trying to push, even when the intestines are not actively helping. As a result, the veins expand under pressure, tissues stretch in ways they shouldn't, and inflammation begins at the very start of the day. For those who already struggle with hemorrhoids, this morning habit magnifies the problem dramatically. The tissue is more vulnerable, the veins are more reactive, and any extra strain deepens the inflammation that didn't fully resolve during the night. Even if the stool is not hard, the pressure alone irritates the region. Even if the bowel movement is small, the strain leaves the veins swollen and the tissues irritated. And even if the discomfort seems mild in the moment, it sets the stage for the pain that appears later. Pain during the next bowel movement, pain when sitting, or that throbbing fullness that follows you into the afternoon. This is why a habit that looks harmless ends up becoming one of the strongest triggers for vein pressure and bowel pain. The body is not resisting because it is defective. It is resisting because it was awakened too abruptly and asked to do something that requires coordination, softness, and timing, none of which exist in the first minutes of the morning. Now that the habit is clear, the next step is understanding what happens physiologically when this pressure is applied. Because once you see what the body experiences in those moments of strain, the connection between morning behavior and daily pain becomes undeniable. When you force a bowel movement first thing in the morning, the pressure inside your abdomen rises far more quickly than your pelvic veins can handle. These veins are designed to expand and contract gently, following the natural rhythm of digestion. But in the early morning, they are already partially congested from the stillness of the night. Their walls are slightly distended, their circulation slower, their surrounding tissues more sensitive. This is the worst moment to apply force, yet it is the exact moment when many people push the hardest. Forcing a bowel movement creates a sudden, sharp increase in intra-abdominal pressure. The diaphragm moves downward with no coordination from the pelvic floor, which should be relaxing but is still tense from sleep. Instead of opening to allow passage, the pelvic floor tightens even more. The result is a closed system, a chamber that traps pressure instead of releasing it. When the abdomen pushes down and the pelvic floor pushes up, that pressure has only one place to escape: outward, into the veins that line the rectum and anal canal. These veins are delicate. They are filled with smooth tissue that responds quickly to pressure. Under a normal bowel movement, they expand gently and return to normal. But when you push with the body unprepared, they expand too fast, too forcefully, and with too much internal resistance. The walls of the veins stretch beyond what they were designed to handle. The tiny supportive fibers around them, responsible for keeping them in place, strain under the sudden load and begin to weaken over time. This is where burning, throbbing, and heaviness come from. These sensations are not random. They are the physical experience of blood being trapped in swollen veins, that cannot drain properly. The pressure prevents normal circulation. Blood pools, tissue inflames, and the discomfort that starts subtly after waking grows into pain during your next bowel movement, even if you did not strain at that moment. The habit creates another problem: friction against tissues that were already swollen. Even a soft stool can irritate inflamed veins when the pelvic floor is tense and the passageway is narrower than it should be. The tissue becomes irritated, inflamed, and sensitive. Microtears can form, not large enough to cause visible bleeding in every case, but enough to trigger inflammation that lingers long after the morning is over. And inflammation doesn't stay in one place. It spreads. The swollen veins disrupt the natural movement of the rectal tissues. The muscles around the anus become protective and tighten, creating more resistance for the next bowel movement. This tension makes it feel as if you need to push harder, which leads to even more pressure, more swelling and more irritation. The very act of forcing in the morning teaches the body to expect discomfort, and the body adapts by becoming tense before you even sit down, a cycle that reinforces itself day after day. By the time the afternoon arrives, the pain you feel is not from something new that happened. It is the echo of what your veins went through early in the morning. The pressure, the friction, the swelling, it all started the moment you forced your body to do something it wasn't ready for. And now that you can see this internal chain reaction, the next part reveals what happens when this becomes a daily cycle and why hemorrhoids seem to flare up out of nowhere, even when you think you're doing everything right. Once this habit becomes part of your morning routine, the body enters a cycle that repeats itself day after day, a cycle that quietly keeps hemorrhoids swollen, irritated, and unable to heal. It begins the moment you sit on the toilet immediately after waking. The veins, already sensitive and congested from the night, face a sudden rise in pressure. The tissues swell, the blood lingers, and the region becomes inflamed before your day has even started. But what makes this cycle so powerful is not just this morning event. It's what happens afterward. The swelling caused early in the day doesn't simply disappear. It follows you. As you walk, sit, bend over, or go through your routine, the tissues remain irritated, warmer than usual and more reactive to any movement or friction. Even the simple act of sitting down for long periods traps more pressure in the pelvis. Standing for too long does something similar, pulling blood downward and slowing the venous return. The veins that were already struggling to drain become increasingly overwhelmed, and the inflammation that began in the morning quietly intensifies as the hours pass. Because the veins never fully recover, the nervous system begins to anticipate discomfort. The pelvic floor tightens out of habit. The abdominal muscles respond by bracing more often. And every time you need to go to the bathroom later in the day, the passageway feels narrower, more resistant, more sensitive, not because your digestion is suddenly worse, but because the morning strain set the tone for the rest of the day. This is why people often say their pain comes and goes. It's not random. It's the rhythm of inflamed tissue that receives pressure early in the day, temporarily calms down, and then flares again when the intestines move or when you try to have another bowel movement. The inflammation never finishes resolving because every morning resets the process, swelling the veins again, irritating the tissues again, triggering tension again. It's like starting each day by reopening a wound that was trying to heal overnight. In this cycle, even on days when the pain feels minimal, the tissues are not fully healed. They are simply quieter. The moment pressure returns, during stress, sitting too long, lifting something heavy, or attempting another bowel movement, the discomfort resurfaces. And because the foundation of the issue happens every morning, the body never gets the uninterrupted time it needs to repair the veins and calm the inflammation. This is also why hemorrhoids feel unpredictable. Some mornings feel fine, others feel heavy, and others come with immediate discomfort. But the pattern behind it is always the same. Early morning strain triggers localized swelling, and that swelling shapes the rest of the day. When this cycle repeats long enough, the veins become more reactive, the tissue more sensitive, and the pain more persistent. Understanding this pattern is the turning point, because once you see how the morning strain sets everything in motion, it becomes clear why nothing seems to fully improve, and why the relief you want depends on breaking this cycle at its very beginning. In the next part, you'll see exactly how the body changes when this habit is removed and why the path to healing is much closer than it seems once the cycle is interrupted. When you see the entire process from beginning to end, the connection becomes unmistakable. The pain during bowel movements, the heaviness that follows you through the morning, the swelling that seems to appear out of nowhere, none of these things happen randomly. They all trace back to a single moment at the start of your day. A moment when your body is still waking up, your veins are still heavy from the night, your breathing is shallow, and your muscles are not ready to release. Forcing a bowel movement in that fragile state creates a surge of pressure, one that inflames the veins before your day has even begun. But there is something empowering about understanding this, because once you know the source of the problem, everything becomes more manageable. The discomfort is no longer a mystery. The pain isn't something unpredictable. It has a pattern, a trigger, and a clear starting point. And that means it can be changed. When you stop pushing the body before it's ready, the cycle that has been repeating for months or even years finally breaks. The transformation begins quietly. The veins no longer swell the moment you wake up. The pelvic floor, no longer bracing against early strain, starts to regain its natural rhythm. The tissues that were always irritated begin to calm down, little by little, day after day. The pressure you used to feel during your first bowel movement becomes lighter. The burning fades. The heaviness lifts, and the sensitivity that once followed you through the afternoon begins to disappear as the veins finally get the uninterrupted time they need to heal. Your digestion, too, starts to change. Without morning strain, the gut moves in its own time. With smoother waves, less tension and less resistance. Your body reclaims a rhythm that feels natural instead of forced, and the clarity that comes with this is profound. You begin to understand how much of your discomfort was tied to a single habit, one that never seemed harmful until you saw what it was doing inside you. If this video helped you see your body with more clarity and helped you understand why your mornings have been setting the tone for your discomfort, consider subscribing to Relief Health. Here, we don't just talk about symptoms, we explain what's happening inside you in a way that finally makes sense. And remember, when your mornings begin without pressure, your entire day changes. Your veins recover, your digestion improves, and your body finally has the space to heal.